Hello there, this is Achilles drill where nearing success gets simplified, and welcome to my lecture today on some common steeplechase questions associated with the anatomy of the brain, neuroanatomy. This lecture is actually divided into four different parts. In this particular part, we emphasize on some common steeplechase questions that can be thrown at you from the superolateral view of the brain. In subsequent lectures, we'll dive into the horizontal and coronal section through the brain, the sagittal section through the brain, the inferior view of the brain, and of course the brainstem. It's sure going to be an educative session. Ensure you work with me to the end. All right, let's get straight off. Now, from this picture, you can see the superolateral view of the brain, and of course, you can see right here that a structure has been pinned here. If we are to be very specific, it is a sulcus right there that is pinned. Okay, so that is one view of the brain. There is still another one, still the same picture, just a better view. And then we come right here, we are taking a look at the lateral view of the brain. We're looking at the brain from the side. Okay, you agree with me? This is the frontal part of the brain, and right here is the temporal lobe, of course. All right, and you can see a sulcus right here has been pinned, and right here a gyrus too has been pinned. So I will walk you through some important parts of this brain in which questions can be thrown at you. Here is a textbook picture for the lateral view of the brain, and you can see a number of gyros and sulcus right there has been labeled. I will give you tips on how to identify each of these sulcus and of course the gyra. But let's start with the very beginning. What is a sulcus? What is a gyros? What is a fissure? Okay, so now you do have to understand that a sulcus in neuroanatomy simply means a shallow depression. So the ridges of the brain or the surface of the brain is such that it is thrown into ridges. There is usually an elevation of a gyrus, that is a brain tissue, and then there is a depression called the sulcus. Just as in some cases, this depression can be really deep. In such cases, we regard it as a fissure. Okay, and we have such fissures in the brain. Three important ones, as a matter of fact. We'll get there. So now, a sulcus again is a shallow depression, while a fissure is a deep depression. Okay, let me walk you through some major fissures of the brain. There are three major ones. There is the longitudinal fissure, the one in the midline. Of course, this is sure the superior view of the brain, and what we're having right here is the lateral view of the brain. So from the superior view of the brain, looking at the brain from the top, there is this longitudinal fissure that separates the hemispheres of the brain into left and right, the cerebrum. Okay, so that fissure is called the longitudinal fissure, and that part can be pinned in your steeplechase. And even right here, there is also this fissure called the transverse cerebral fissure. The transverse cerebral fissure demarcates the cerebrum from the cerebellum inferior right there. Okay, so that fissure is running transversely. And we also have one important fissure which is more like a combination of a fissure and a sulcus, and that is the lateral fissure. This lateral fissure separates the temporal lobe of the brain from the frontal lobe right here and the parietal lobe. So the reason why I call it a combination of a fissure and a sulcus is the earlier part of the depression is such that it is quite very deep. As a matter of fact, you can literally probably insert a pen there. But as you go deep into the brain, the groove gets shallower. So in that case, we can just call it a sulcus. But then it's just advisable to just regard everything as the Sevian fissure or the Sevian sulcus. Okay, and still the same picture of this very unique lateral sulcus, otherwise called the Sevian fissure, is right there, and it is separating what again? Separating the temporal lobe from the frontal lobe and parietal lobe right there. That fissure runs like that. Okay, so and as a matter of fact, there is still a part of this sulcus, this lateral sulcus, that actually projects into the lower gyrus right here. This is the inferior frontal gyrus of the brain. But the thing is, as the Sevian or lateral fissure is running through the brain, it kind of gives some demarcation into this inferior sulcus, right, into this inferior gyrus. So it divides that gyrus into three different parts. We'll get to that part in the course of this lecture. Okay, right here, there's a rib brain, and we can see a part pinned B right here. That's a sulcus where we will dive there. But my point is, we already established the common features of the brain, and you do have to understand that that feature right there, this longitudinal feature, it could be pinned and you'll be asked to identify it. Yeah, it is the longitudinal feature. It separates the right and left hemisphere of the brain, okay, the cerebrum. Right. So let's move downwards and let's go ahead to identifying some other common sulcus and gyri associated with the superolateral view of the brain. Okay, the first I like to start with is the central sulcus. The central sulcus is that part of the brain that separates the frontal lobe from the parietal lobe. The central sulcus is what we have here, and it separates what? It separates the frontal lobe from the parietal lobe. Okay, and just anterior to this central sulcus, which is already given green, right? Okay, let me give it a red. Just anterior to it, there is an important gyrus called the precentral gyrus, and posterior to it, there is also an important gyrus called the postcentral gyrus. Okay, and anterior to each of these gyrus too, there is also a sulcus. Okay, let me give that a yellow. Right here, anterior to the precentral gyrus is the precentral sulcus, and then posterior to the postcentral gyrus is also the postcentral sulcus. So from the central sulcus, which is given red right here, there is an elevation of brain tissue, that is a gyrus, right? And we already identified those gyrus. The one on the anterior part, this of course the frontal part of the brain, posterior part of the brain. So the one in front right here is the precentral gyrus. The one posterior right here is the postcentral gyrus, after the central sulcus rather. Okay, after the central sulcus. So that gyrus is called the postcentral gyrus. And then I'm also drawing your attention to the sulcus just anterior to each of these gyrus. Okay, so the first one is this precentral sulcus, and right here is the postcentral sulcus. Okay, so those parts can be pinned in your steeplechase, and it's important for you to recognize them. Starting with the central sulcus, there is this important way in which I recognize the central sulcus. The central sulcus is not totally or perfectly in the central part of the brain. As a matter of fact, it's just a bit posterior to the midpoint between the frontal pole and the occipital pole. Okay, but I'll give you other hints as regards identifying the central sulcus. From here, of course, the central sulcus are also represented as a red here. The central sulcus is what we're having right here. But one way I recognize the central sulcus is the fact that no other horizontal sulcus directly open to it. Okay, let me walk you through this. The central sulcus is a vertical sulcus. Even the precentral sulcus right here, also a vertical sulcus. The postcentral sulcus too is a vertical sulcus running right there. But the central sulcus is unique in the sense that there is no horizontal sulcus that opens directly into it. What we have immediately in front of the central sulcus is a gyrus. Immediately posterior to it is a gyrus. Okay. Unlike the post and precentral gyrus, you can see some horizontal sulcus opening into it. Okay. They open into the post and precentral sulcus. But the central sulcus in the midline, what we just have anterior and posterior to it is directly brain tissue, a gyrus. Okay, and those gyrus are the precentral gyrus and postcentral gyrus. Okay, there should be a better textbook picture here. Okay, can you come down here and see the part in blue? Let me label it to blue. This is the central sulcus, of course, and just as stated earlier, anterior to the central sulcus is what? The precentral gyrus, and posterior to it is what? The postcentral gyrus. But anterior to each of these gyrus, we're having an important sulcus. The one anterior to it is the precentral sulcus, and the one posterior to it is the postcentral sulcus. And I'm stating now that these post and precentral sulcus are such that some horizontal sulci open into them. We have the superior frontal sulcus right there, and then inferior to it somewhere right there, and they are opening into the sulci. Even from the back to some horizontal sulci also open directly into it. Okay, so but in the case of the central sulcus, nothing really opens to it directly. The sulcus is just right there, independent in the midline. Are we good? And with that, I easily recognize the central sulcus of the brain. Still a beautiful textbook picture. Can we say the same thing? Just a quick summary, a quick revision. We started with the various fissures of the brain. We already established the longitudinal fissure, already established the transverse cerebral fissure, and even the Sevian fissure, otherwise called the lateral fissure right there. Okay, so and then we moved straight to the central sulcus. We identified it and we stated that just anterior to it are some gyri. Okay, first one is the precentral gyrus and then postcentral gyrus right there. And then anterior to each of these are what? Precentral sulcus, which is right here, and then postcentral sulcus. And of course, we can see some horizontal sulci opening into them already from the back and also from the front. This is definitely the superior frontal sulcus opening into it, and then the inferior frontal sulcus also opening into it right there. Okay, so that brings me to the frontal lobe of this brain. I would like to draw your attention to these two sulci I just labeled yellow. That is the superior frontal sulcus and the inferior frontal sulcus, which actually divides the frontal lobe of the brain into a superior frontal gyrus, middle frontal gyrus, and inferior frontal gyrus. Okay, so those parts can be pinned in your steeplechase, and you'll just be asked to give the name. What gyrus is this? Middle frontal gyrus, superior frontal gyrus. Maybe it's the sulcus, especially the three we just mentioned right here: the central, the post-central, and the precentral, or the gyri themselves. The gyri themselves can be pinned and you'll be asked to identify them. So, and another name for the post-central gyrus is the somatosensory, the primary somatosensory area. And then the another name for the precentral gyrus is the primary motor area. Okay, so we now dive into other things associated with this superolateral view. Yeah, I would like to say more about this frontal lobe, the frontal lobe of the brain. That's this region right here. We already established the superior frontal sulcus and then the inferior frontal sulcus, which is dividing the brain, the frontal part of the brain, into superior, medial, and inferior frontal gyrus. But there is something really unique about the inferior frontal gyrus of the frontal lobe. It is such that the lateral fissure, otherwise called this lateral sulcus, it divides it into three parts. Okay, the thing is, as the lateral sulcus is traveling upwards, it gives an anterior ramus, it gives an ascending ramus, and then it gives a posterior ramus. So as that lateral fissure is traveling through the brain, it subsequently divides this inferior frontal gyrus into parts. So, and those parts are the first one right there. Let's start from the front. This one labeled 3 right here is a pars orbitalis of the brain, and then the one labeled 2 right here is a pars triangularis, and you can sure see that it is like a triangle. Okay, the pars triangularis looks like a triangle, and of course the one right here, the most posterior, is the pars opacularis. Okay, so pars opacularis and pars triangularis are in fact very important. They contribute to forming the Broca's area of the brain. You must have heard of the Broca's area, the Broca speech area of the brain. That's area 44 and area 45. Okay, those regions are very important in language production. Okay, there's also one part right here on the superior temporal gyrus. That part is called the Wernicke's area. The Wernicke's area is associated with language comprehension that involves ability to comprehend spoken words or written letters. That's the Wernicke's area, area 22. Okay, so don't forget pars opacularis and pars triangularis, they contribute to the formation of the Broca speech area, area 44 and area 45. Okay, I will still say more on those areas. So yeah, we can see them right here. This is area 44, which is pars opacularis, and then the pars triangularis is area 45. And the one right here that is not too associated with the A Broca speech area is the pars orbitalis, and that too can be pain. So please, I really want you to take note of this inferior frontal gyrus. Quick summary, quick summary. We're talking about the frontal lobe of the brain, and we established that the frontal lobe is divided by two major sulci, the superior frontal sulcus and the inferior frontal sulcus, which is dividing the frontal lobe of the brain into superior frontal, middle frontal, and inferior frontal gyrus. Okay, so but this inferior frontal gyrus is unique such that the lateral fissure of the brain divides it into three parts. Those are the pars orbitalis, pars triangularis, and pars opercularis. Okay, can we move on and say other things as regards superolateral view of the brain? Okay, right now I want to draw your attention to some common Broadman area of the brain, specifically this superolateral view. Okay, so we already established the central sulcus of the brain, which is right there, and the primary somatosensory area, otherwise called the postcentral gyrus, and the primary motor cortex, otherwise called the precentral gyrus. Okay, so apart from you being asked to identify what gyrus it is, you can be asked to give the Broadman area. Okay, and some common one is this pre and postcentral gyrus. The precentral gyrus, otherwise called the primary motor area, is associated with the Broadman area number 4, while the primary somatosensory area, otherwise called the postcentral gyrus, is associated with Broadman area 3, 1, and 2. Not 1, 2, 3, not 2, 1, 3, but 3, 1, and 2. Okay, so I really want you to take note of those for the premotor area, the primary motor cortex rather, that's the precentral gyrus, and then this for the postcentral gyrus. Okay, so another part is the Broca speech area, which I mentioned earlier, and we're having that right there on the pars triangularis and also on the pars opercularis right there, and that involves area 45 and area 44 and 45, and we said it is pars opercularis that is area 44 and pars triangularis is area 45. Okay, so let's go down to talk about the Wernicke's area. I was mentioning something about the Wernicke's area. The Wernicke's area is right here. Traditionally, it is located on the superior temporal gyrus. I sense someone is confused, okay, but let me walk you through this. Yeah, we do have the temporal lobe of the brain. Yeah, we already established the part of this frontal lobe. But on this temporal lobe of the brain, just as we had two sulci, superior and inferior sulci, dividing the frontal lobe into superior, medial, and inferior gyrus, we also have something similar on the temporal lobe. There is a superior temporal sulcus and an inferior temporal sulcus, which is in turn dividing the temporal lobe into a superior temporal gyrus and a medial temporal gyrus and an inferior temporal gyrus. But I'm saying now that the Wernicke's area, let me give it pink. Okay, the Wernicke's area is actually on the superior temporal gyrus, but part of it projects into the supramarginal gyrus and also the angular gyrus, which is located right there. They kind of spill over to those impacts. Let me show you a better picture of this. Yeah, I really love this textbook picture. Can you come down here and you can see the various parts of the temporal lobe that we already identified. And you can see the Wernicke's area is actually somewhere here. It is on the superior temporal gyrus, but part of it projects into the supramarginal gyrus of the parietal lobe. Okay, so and that's that about that. Can we now come down to talk about other things we're leaving out? Yeah, here is the Wernicke's area. You can see it spilling over to some other part of the parietal lobe. Okay, so what is the function of this two area to start with? You do agree with me, Broca's speech area is for language production, phonation, and all. It's associated with some important motor neurons. Those motor neurons are they kind of control the muscles associated with speech. And then Wernicke's area, just let comprehension come to your mind. When you hear Wernicke's area, let comprehension, language comprehension. It can be in form of spoken words or in form of written letters. Very, very important. Okay, so if I'm to ask you from our lecture so far, from the orientation so far, what sulcus is pinned here? You can pause this video and then reflect on what part is pinned there. All right, I do want to believe you've taken the short assessment. And what was your answer? Well, I will give you the answer right now. But before that, let me walk you through as regards identifying what sulcus is pinned here. Okay, let's zoom into this. The first step to identifying these circles is to get your orientation right. So, is this the anterior part of the brain, or is it this part that's the anterior posterior? Well, you do agree with me that this is the frontal part of the brain, that is anteriorly, and then certainly this is the posterior part of the brain, the occipital part. Of course, you can see a piece of the cerebellum right there. So the sulcus pinned right here now. What sulcus is this? Is it the central sulcus, or is this the procentral or precentral? Okay, we already know that the central sulcus is such that no horizontal sulcus opens directly into it. Okay, that's how we identify the central sulcus from the lateral view of the brain. Okay, the thing directly in front of the central sulcus is a precentral gyrus and a postcentral gyrus. There is really no horizontal sulcus opening into it directly. Okay, so that means the part pinned B here, the sulcus pinned B here, can't be our central sulcus, because we can see here that some horizontal sulci are opening into it already. Okay, so but does this one look like our central sulcus? Actually it does, because you can see readily that what is in front here is the precentral gyrus, and the gyrus right here is the postcentral gyrus. Okay, and immediately anterior to this precentral gyrus is actually the precentral sulcus, which is kind of regularly shaped right there. Okay, the precentral sulcus is right there, and some horizontal sulci are opening into it already, specifically the superior frontal sulcus and the inferior frontal sulcus. They are opening directly into it already. So the part pinned right here again is our what? Is our post-central sulcus, while the one right here is the central sulcus, and the regularly shaped one right here is the precentral sulcus. And there is a typical maybe superior frontal sulcus right there, and then the inferior frontal sulcus to be somewhere here, opening into the precentral sulcus. Okay, so let's move on to other questions here. All right, now from this picture, what part is pinned B here? Can we try and zoom in here? All right, so of course it is a sulcus that is pinned here. And what sulcus do you think that would be? Of course, the lateral sulcus, otherwise called the Sylvian sulcus. Okay, so and that's the sulcus separating the temporal lobe of the brain from the frontal and parietal part of the brain. Now, what part is pinned here? Actually, it is a gyrus that is pinned here. And what gyrus is this? We already know that the gyrus inferior down here is the inferior frontal gyrus. Okay, but we need to be more specific here. Of course, this is the inferior frontal gyrus, but a part called the pars triangularis is actually what is pinned here. So you can be asked to identify A here, which is pars triangularis, and posterior to it here too, you can see the pars opercularis, and then anterior to it right there, you can see the pars orbitalis. Okay, so you can also be asked to identify the Broadman area. What Broadman area is this? And this is actually Broadman area number 45. Okay, that's pars triangularis, right? So, and it is associated with language production, okay, phonation, right? That's a Broca speech area. Okay, let's talk about other things. And right here, can you come down here too? Of course, it is a structure on the temporal lobe. Get your orientation right. This is the posterior part, occipital part, and definitely this is the frontal part. Okay, so what structure, what gyrus is pinned here? Actually, this is the superior temporal gyrus, All right, and well, it's not too posterior. Had it been it was this region that was pained, we could have concluded that okay, that is the Wernicke's area. But since the part pained there is still close to the really close to the temporal lobe, so we just stick with the superior temporal gyrus. All right, so let's identify other things. What part is pained here? This is the anterior most part of the inferior frontal gyrus, and actually that is the pars orbitalis. Again, the inferior frontal gyrus is divided into three. There is an anterior most pars orbitalis right there, a middle pars triangularis, and of course there is also a pars orbicularis right there. Okay, so those are the various parts of the inferior frontal sulcus. So right now let's come to the meninges of the brain. Sometimes you could be asked to identify maybe a part of the dura mater. For example, from this picture, you can see right here what is pinned here is actually the tentorium cerebelli. Okay, the tentorium cerebelli of the dura mater, which is actually separating the occipital part of the cerebrum from the cerebellum inferiorly. Okay, there is actually a better picture down here. All right, this is a textbook picture actually showing the different parts of the dura infolding. You can see right here is the first cerebri. Okay, the first cerebri is actually separating the two cerebral hemisphere. Okay, the right cerebral hemisphere and the left cerebral hemisphere. All right, here's the tentorium cerebelli separating the occipital from the occipital lobe of the brain from the cerebellum. Now, apart from the parts of the dura mater themselves, you could be asked to identify a structure associated with it. Okay, for example, now the superiormost part of the first cerebri is associated with the superior sagittal sinus. Okay, while the inferiormost part of this tentorium cerebelli is associated with the petrosal vein, the superior petrosal sinus. Okay, the superior petrosal sinus is running right there along the attachment point of the tentorium cerebelli. And even down here too, there is a straight sinus associated with the meeting point of the first cerebri with the first cerebelli. Okay, and behind here is actually the confluence of sinuses. Okay, that region right here is associated with the confluence of sinuses, where superior sagittal sinus is meeting with inferior sagittal sinus, the transverse sinus, and also the straight sinus, the confluence of sinuses right there. Okay, so here is a picture showing those various sinuses again. Superior sagittal sinus, inferior sagittal sinus is running down here. We didn't mention it. Okay, so you could be asked to identify. So let's go back to this picture. So if this part was actually painted, you will agree with me that that region is associated with the inferior sagittal sinus. And of course, this superiormost part is associated with the superior sagittal sinus. Okay, so another thing associated with the dura mater is the blood supply. A blood vessel around the dura mater can be pained, and most likely it is a branch from the middle meningeal artery. Middle meningeal artery is a major blood supply to the dura mater. It is a branch of the external carotid artery, passes through the foramen spinosum, and then it divides into numerous branches. Those branches are supplying the dura mater, That's that about that. Now, rather than an actual dura mater, sometimes what you have is a printed picture, and you'll be asked to identify different parts of that picture. For example, what we have here, you can see it has been labeled 1, 2. Okay, let me get my pen. You can see this place has been labeled 1, 2, number 3, number 4, number 5, and all. And you'll be asked to identify these different parts. I do have the exact picture of this, and that's what we have here. All right. So different parts can be labeled here and you'll be asked to identify it. Let's use this picture. You can agree with me that the part labeled 2 here is definitely the inferior sagittal sinus. The part labeled 1 is the superior sagittal sinus. The part labeled 5 is obviously the first cerebri itself, which is separating the two cerebral hemisphere. And the part labeled 4 is definitely the straight sinus, as we explained earlier. And 5 right here is associated with the superior petrosal sinus. So it's very important to familiarize oneself with these different parts of the dura infoldings, and the sinuses associated with them. And that brings us to the end of this lecture on some common steeplechase questions associated with the superolateral view of the brain. In subsequent lectures, we'll still talk about the sagittal section through the brain, the horizontal and coronal sections through the brain, the inferior part of the brain, and of course the brainstem. Okay, if you find this video helpful, do it to hit the like button and also subscribe and switch on the notification button, and check the description box for an online quiz I've provided for you to consolidate all we've learned so far on the superolateral view of the brain. Thank you for tuning.